The World University Service of Canada, WUSC, was incorporated as a non-government organization based in Toronto in 1948, despite beginning its works just soon after the First World War. In the late 70s, WUSC went beyond borders and reached out to developing countries in Africa, Asia, and Latin America, primarily sending teacher volunteers to government schools. In 1981, WUSC Malawi was born.
WUSC Malawi started working in Malawi in 1981, and since then we have implemented many projects and many activities that have positively contributed to the national goals, such as the Malawi Poverty Reduction Strategy, then now the Malawi Growth Development Strategy, as well as the Millennium Development Goals. We started with a volunteer program which focused on education, and the first program was the volunteer program, through which we mobilized and brought to Malawi Canadian volunteers who worked as secondary school teachers in many of the government schools, as well as as tutors at Domas College, Teachers Training College. We still continue implementing the volunteer program up to now, but we have expanded to other sectors like the HIV and AIDS, health, agriculture, and we also bring in students who help at the Dzaleka refugee camp, as well as work in other areas such as gender equality. This the volunteer program is the main and biggest program that we have implemented ever since we started in Malawi in 1981. However, we have also implemented and we continue to implement other programs, which include the Applied Research Program, the Intern for Global Challenge Program, the NetCops Program, the International Student Seminar, which we hosted in 2000 and 2004, and we are implementing Student Refugee Program, which started in 1998, and we continue to implement the program up to now. We continue to implement the Bike for AIDS project, which started in 2006. We also implemented the grant support to the education sector between 2006 and 2010, and since 2006 we have been administering the Canada Fund for Local Initiative on behalf of the Canada High Commissioner, currently based in Maputo. Over the 30 years, a lot of achievements have been made. We have made positive contribution towards people, and we are proud so far for the contribution that we have made and the positive changes that we've been able to make through our partner organizations and the people that we work with.
Through Unitera, short-term as well as long-term volunteers are recruited from Canada and other countries in which WUSC is operating to work in various development sectors. The first volunteer teachers had a positive impact on their students.
Being with the WUSC volunteers at school, according to my experiences and when I come and see, I view how with my colleagues who were together at Masonga Secondary School, it has helped quite a lot. Because Stonehouse was able to explain more to make sure that everybody has to understand what is really trying to say. And in our class, no one could pass below 50%, because she could make sure that everybody, if you have a problem, she could make set as a free time for herself to meet some students who could have difficulties in understanding the topics. This has helped me quite a lot. That from Songola Assembly School, I happened to go to Polytechnic, because I know that I was sharpened at the early stage that time.
With this program, a lot of Canadians have taken part in local development initiatives in Malawi. Last year, a group of 5 student volunteers from Sherbrooke University in Canada built a resource center for Manaso in Nzuzu under the Geesias initiative. Similar building projects have been done in Chikwawa and Dowa districts.
WUSC has been partnering with CARICOM, particularly in an area of support for the construction of a warehouse. WUSC sent 7 volunteers, that's around 2056, to actually do the construction. The project took almost 7 months to complete. It was quite a big success for us. It's a direct benefit to the community, and also a very direct benefit not only to it's not only CARICOM, by the way, that is using that warehouse. We have other commissions. We have got the Catholic Health Commission has commodities. It also uses the same warehouse. The Malawi government also, sometimes when there are commodities, they have run short of space to provide to the community. They also come and ask for some space in the warehouse. So there's been a very great help to CARICOM.
We have been working with WUSC in a number of areas. WUSC has been providing the financial support to Mike, as well as technical support in different programs. For example, the HTC or the VCT lab, which we have, it was provided by WUSC with a sum of 3 million kwacha, and this was done through Unitera program, where Canadian students from the university mobilized resources, and then in partnership with our organization, they came up with the VCT. As for Mike, we just contributed 25% of the labor from the community, including bricks and sand. It has been a great success. There is now high turn-up of clients, those coming for HTC. And the current scenario now, even the government hospitals, they are not able to provide adequate resources in terms of HTC. So it's like this VCT center is the hub of the HTC services here in Mponera.
Other volunteers have worked in several other development sectors like early childhood development, HIV/AIDS prevention, and monitoring and evaluation, just to mention a few.
We have been getting capacity building help or assistance from World University Services of Canada, WUSC, through volunteers. This is directly to us as NAPAM, as an organization, but also sometimes we get it through our mother body, Manate Plus. So we have been getting quite a number of volunteers for quite some time now. I remember I've joined NAPAM for 3 years, and in those 3 years, we have had an opportunity to have 3 volunteers directly placed with us as an organization. But throughout the years, we were able to get some input from Manate Plus through the volunteers that were placed at Manate Plus.
My name is Caitlin Williscroft. I am a Canadian volunteer with the World University Service of Canada. and I'm placed with a partner organization, the Malawi Network of AIDS Service Organizations, and I am a gender and human rights advisor. Right now at Manasso, I'm working on a gender audit, which is essentially an organizational assessment and evaluation of how an organization is doing when it comes to gender. So I'm working with a Malawian colleague at Manasso, as well as 4 smaller organizations underneath Manasso's network, just to understand and learn about how these organizations can improve their gender policies and their gender programs. Hopefully my expertise will work in building the capacity and the knowledge of individuals who are in senior management positions in these organizations so that they can create their own change within their organization, so that they can be the leaders in coordinating gender work and taking leadership so that they can move their ideas and their knowledge and their kind of technical expertise that they've learned from me into real action.
At Rainbow Home-Based Care, 2 WUSC volunteers, Kathleen and Chrissy, helped set up a business where women at the center make handbags and sell them locally and in Canada. Mrs. Anastasia Chikasu is one of the beneficiaries of this initiative.
The making of Zugomo bags started with an initiative by WUSC volunteers Kate and Chrissy from Canada. At first, we used to sew, but it wasn't yielding tangible profits. When these volunteers saw our potential, they asked us to be sewing these bags, which we call Zugomo. WUSC provided funding that enabled us to start making these bags. This Zugomo bags project has helped us so much that others managed to buy fertilizer last year. It is encouraging us to work hard because we are earning out of it.
First time of working with WUSC was in 2006 when Sarah came here. She worked as a resource mobilizer for Manasso. She facilitated us on fundraising, on proposal writing. She even also sent us to Jongoni, where we are trained on herbal medicine. And herbal medicine is also a fundraising, but it's one of our ideas that we have here. Herbal medicine offered is a unique program because I'm saying it's unique because it's the only program that I see that a lot of people are interested in. What happens is that we have got the program of home-based care. Here in Chilimba itself, we don't have any clinic. And being working with in a program of home-based care, we found it's a big challenge to us because we do not have any home-based kit. So when the volunteers go into these homes and for the clients, they found that the client has good rashes, but she doesn't have any medication. So if we do this, our own home herbal medicine, the ointment, when they are going to the field, they do to take their bag, and in the bag there's a power drink, there's this ointment, there's these powders like moringa, there's artemisia, and other things.